Hi, I'm Marion Dunstone. I'm the Director of Operations for Hertfordshire Community Trust, and I'm the Exec Lead for palliative and end-of-life care in the organisation. And getting good quality palliative end-of-life care is one of our key priorities for both adults and children in the organisation. And in this film, Mary and Sarah are going to talk you through how you do that on a practical basis with all of your patients when they need it.
Services. So what the key things that we need to get across.
Okay.
So I think the first key thing is the gold standard framework question, the surprise question.
Yeah, absolutely. Asking people, would you be surprised if this person would not be here this time next year? And if you wouldn't be surprised, it leads to a holistic assessment, doesn't it?
Okay.
So in that holistic assessment, you would find out, or at least offer up, an advanced care planning conversation so that we can ask patients of whatever age what their wishes and preferences are towards their end of life, where they might want to be cared for, where they would like to die, and to be absolutely sure that we document it in the right place, in the sequin template that is soon to be all singing, all dancing, all encompassed into a generic end of life template. So we'll have advanced care planning to start with. Then we'll have an assessment, and then we'll have a section about end-of-life care. So it really will hopefully make it a lot easier for staff to document the care that they are supplying, delivering.
Okay, and obviously linked to that is the priorities for end-of-life care.
Absolutely.
So the key priorities are that we're recognising, like we've said, that somebody is in their last year of life, that we're communicating. So how are we getting that across to the wider teams, to the patient themselves, that they're in their last year of life, and that we're involving the wider network of people that are involved with that patient. What support are we offering? Are we offering that carers assessment? And also how are we planning and doing? So that's obviously where our advanced care plan for children, young people and adults come into play.
Absolutely. If we know those things in advance, when it comes to someone's death, we actually know what their priorities are, and it makes it so much easier, doesn't it? And it takes a little bit of what is a very stressful situation less stressful for the families, for the patient, and also for us as staff. But it's really important that we document the individualised care plan in the right place. There is a template specific for it, and as I've just said, we're going to try and make that easier for people to access. But we need to get staff to think about, if someone's on a syringe pump, are they having their documentation within the individualised care plan and saved accordingly? And I'm not sure that happens as well as it could.
Okay, and then leading on to that obviously is recognising, is that patient, child, young person or adult, have they got any pain? Yeah, so utilising the pain templates correctly. Assessing pain, but also revisiting pain and making sure that we are treating the pain and we're not just documenting it, and that we are registering that within the pain templates on System 1.
Absolutely, because then we'll get outcome measurement evidence, won't we? And that's really important. We need to be mindful of that. Yeah, okay. That's a good point. And we've got lots of things to back us up, haven't we? We've got the end-of-life policy, which is a very usable, very informative policy. So it's a good go-to if people can't remember things, and let's face it, we can't remember everything.
Yes.
It's a really good policy to be mindful of. It's on the intranet. You just search end-of-life and it pops up. But also we've got the strategy, our HCT visions and values, which are in concordance with national ambitions. So that's a really great document to be aware of as well. We know that our staff are really compassionate. We know that the care is great. What we need to really improve on is the documentation. So if people put the right information in the right templates, happy days.
Absolutely, absolutely.